Okay, so we've touched on briefly the fact that part of the treatment process for dealing with your OCD is about stopping or giving up doing the things that you usually do to try and make yourself feel better in the short term. So that was on the diagram where we had the up and down zigzag versus the habituation of letting yourself feel the anxiety. So I want to have a little look at what are some of the things that people do to try and alleviate their anxiety or discomfort. So let's draw a little circle here. OCD. Okay, so what I'm going to do is look at lots of different things that people will tend to do to try and make themselves feel better. And this is not necessarily an exhaustive list, and some of these things you may do, some of these things you may not. But I just want to talk about it in a general term, so hopefully it speaks to as many people as possible. Okay, so let's look at what people do. So one of the big things that people with OCD will often do is they will avoid. Does that sound at all familiar? So really that would be about trying not to put yourself in a situation which you know is going to bring in your OCD or your discomfort in the first place, or when you see something or hear something or think something that you don't like, you try and avoid it in some way. So that's a big one. What else? Seeking reassurance. I don't know if you can see this. Does that sound familiar to you? Do you ever ask people to try and tell you that it's okay, that you shouldn't be worrying, or that something isn't dangerous? What we find that a lot of people with OCD will tend to seek reassurance a lot, but we're going to look about the fact that it doesn't really help you in the long run. Checking and rechecking and checking again. Okay, so when people with OCD who perhaps have a fear of causing harm will tend to check. So, checking the taps are off, checking the cookers off, checking they didn't run someone over. So that's a very common thing that people do to try and alleviate their anxiety when they have that kind of OCD. Washing, usually oneself. So, obsessive hand washing, showering, trying to get yourself to feel clean. Tapping, that's a thing that sometimes we see people with OCD do. Doing something to try and get rid of the discomfort, the uncomfortable feeling, by performing an action that in your mind makes the whole thing okay. Throwing things out, for example. When you think something's contaminated, you might throw it out, which is, I suppose, a way of avoiding. Repeating actions. An idea that if you get a bad thought in your head, you should repeat the action that you were just doing. Perhaps, whilst thinking something good. That's quite a common thing that we see. So straightening something or ordering it. Straightening. It's very hard writing upside down. Straightening or ordering. Again, when people feel uncomfortable about something being a particular way, they might feel that if they straighten it or they order it, if they put it right, that will somehow alleviate their bad feelings. Obviously, we have cleaning. So rather than just cleaning yourself, obsessive cleaning of a particular area, like specifically in the kitchen and bathroom, that's very common, to try and feel that you've completely decontaminated something. Now, all of these things are kind of actions that people will do. So you could call these sort of rituals or compulsions. And sometimes people with OCD will say, well, I don't have any compulsions. Certainly people who feel they have like pure obsessional OCD, they feel they don't have any obvious compulsions. And it's very rare that people have no compulsions at all. But what they might find is that they've got mental compulsions, as in things that they do in their head rather than outside. So these are all the sort of things that we do externally, behaviours that we do externally to try and get ourselves to feel better. But we also have all sorts of internal things that we tend to do to try and get ourselves to feel better. And a lot of these are done by people, whatever kind of OCD they have. And they're actually an incredibly important part of starting to deal with your OCD differently. So we need to know about those, and those are things like trying to stop your thoughts. Okay, so when you have unpleasant thoughts you don't like, you try and not think them, or trying to stop them coming into your head. Right? Try to stop your thoughts. And we're going to talk a lot more about these bits in another video. Trying to stop your thoughts, trying not to think about it, which might sound similar but slightly different. One is actually trying to stop your having the thoughts in the first place. Another is trying to stop yourself thinking about it at all, trying to block them. Trying to block them out once they're in there, trying to kind of get rid of them. Oh dear, I haven't got enough room. Another one is about trying to replace the thoughts with something good. So sometimes if someone has perhaps an image, a bad image that comes into their head, or a bad thought, they'll try and replace it with a good thought or a good image. What else? Oh, so perhaps like repeating a magic phrase in your head, or a phrase that you feel will somehow alleviate things, or somehow makes the whole thing better. Repeating a phrase. Okay. Another big one is actually trying to get rid of thoughts. So that's similar to blocking. Trying to get rid of them. We find people have been taught to do things like, take the thought and try and put it in the recycle bin in their brain and things like that. So we're going to look at these things specifically about how to deal differently with what we do inside our head with our thoughts. Okay, so this rather messy diagram, what's it showing us? Well, at the moment it's just showing us loads of different things that people tend to do to try and alleviate their OCD. But what do we know about all of these things is that these things are very much short-term fixes. So avoidance, for example, it works usually pretty well in the short term. You avoid being in a situation you don't like, or that brings on your OCD, it's going to make it better short term. But what about when you can't avoid that situation? Does it actually make the problem go away? Or does it, if you keep avoiding something, does it actually slowly make you feel more and more scared of that thing? What we find is the more people avoid something, the more it builds up in their mind. So rather than this making the problem better in the long term, it actually feeds back into the problem and makes it worse. Seeking reassurance now, it makes a lot of sense if you feel scared or about something, that you want to try and get somebody to tell you that it's okay, that you don't need to feel like that. Again, what we know is that this is really not a good long-term fix. And if you do this, you're probably quite aware that even when you ask someone for reassurance, you don't tend to believe them for very long. Now sometimes this can work, sometimes it works a little bit longer, sometimes it works barely at all. Sometimes you will seek reassurance from someone and almost immediately you want to ask them again, just to be sure of what they said. So again, what we find is in the long term, the seeking reassurance is not teaching you to be able to trust your own judgment. It's not teaching you to live with the uncertainty and find out for yourself. So again, it feeds back into the OCD problem. Checking. Now, how does that help you? Well, again, short term, theoretically, it makes you more sure. But does it? Do you actually feel more sure? So you go, you check the door, you think, great, okay, done that. You walk away. How long is it before a thought comes into your mind, but did I check it properly? Or was I really sure of what I saw? Or did I accidentally unlock it? Something comes into your mind to make you unsure again. So the more you check, often, the more uncertain you end up feeling. So again, it feeds back into the problem. I'll come back to, I'm going to do the replacing in a minute. So let's look at washing. You know, contamination OCD is very common. And the more we wash, the more we try and feel clean. How does that feed back into the problem? So short term, it will bring your anxiety down. You get the, phew, I'm clean, hurrah. But when you get that phew feeling, it's like reinforcing the idea that contamination is bad, that it's terrible to feel like that. And so the more you make yourself feel decontaminated and clean, the worse the idea or the feeling of being contaminated becomes. So actually, the more you do it, the more it reinforces the OCD. So you're obviously by now probably seeing a pattern here that all of these things that we do actually in the short term may provide a little bit of comfort or relief, but in the long term they don't cure the problem. So for example, when you tap to try and make yourself feel better about something, say you have a bad thought and you do a tapping ritual, does that mean that next time you get the thought it's okay? Or does it mean that it increases your belief that you shouldn't have that thought and that you need to get rid of it in some way, or you need to somehow make it better? I'm guessing it's the second option. So again, it feeds back into your OCD. Okay, so you can see this pattern continuing where instead of alleviating the problem in the long term and making it better, all these different things that people do to try and get rid of that anxiety or discomfort or disgust, all these things actually feed back into the problem and make it worse. Now, I'm aware that I haven't yet talked about the mental rituals that we perform or the mental responses that we perform to our thoughts. And there's a reason for that, because I'm actually going to do a separate video about learning to deal with our thoughts differently. So in terms of where this fits in, you know, this vicious flower fits rather neatly on top of here. So all those different things are the things that you do to try and bring down your anxiety. But what we see is that in the long term, it doesn't make the problem change, it doesn't make the problem go away. So what we're going to look at next is how can you help yourself to behave differently so you can start to experience this habituation process. And that's something that you may well have heard of called exposure and response prevention, which is where you expose yourself to one of your feared situations or your feared image or thought, and you don't perform the usual response that you would perform. And we're going to talk about that in more detail. So like I said, this vicious flower is showing lots and lots of different possible responses that people might have to their OCD. So obviously it's not necessarily specific to you. So what I'm going to encourage you to do is to think for yourself, what are the things that you do as a result of your OCD? So what do you do to try and alleviate your anxiety? Do you have a tendency to avoid a lot? You know, are you somebody who washes or checks, or do you have certain rituals that you perform? I want you to think about what do you do and write a list of those things and then see whether you can fit them into this vicious flower diagram. So think about the fact that you do them because they work perhaps for you in the short term, but what's the long-term impact of them? Do they actually make a difference to the problem long term? And an easy way of answering that question is, you know, how long have you been doing these things? Have you been doing them for weeks, months, years? You know, if you have, and the problem hasn't gone away or changed dramatically for the better, the answer is probably that these are not good long-term fixes. So once you can get really clear on all the different things that you do, that's going to help you when you start to do your exposure and response prevention, because you need to know what are the things that you do to try and alleviate your anxiety or to try and make yourself feel better, to try and escape from the problem. What are those things? Because if you're not aware of them, it's going to be very difficult for you to stop yourself from doing them.